So the Medicare Wellness Visit is an opportunity to spend more time with the patient, to really focus on prevention and overall wellness, discuss their overall health needs, future goals. It is a bit different than an acute visit when somebody comes in with back pain, or their blood pressure is high, or maybe they're feeling depressed. Those issues still may come up during a Medicare Annual Wellness Visit, but it's really geared more towards prevention. And so we're able to come up with a more proactive, preventive approach versus it being reactive to what's happening. Prior to having the Medicare Wellness Visit with the clinician, typically patients will be asked to fill out an online questionnaire, their health risk assessment. Part of the risk assessment is pretty broad, but it does look at your physical health, your mental health, looks at a lot of the social determinants of health that we may not have the opportunity to talk about at some of our short, earlier visits. Is there chronic pain? What's your general functionality? There is a cognitive screen that might touch upon the need to do a little deeper dive into memory. We also have an opportunity to update any advanced care directives, looking at power of attorney, sometimes looking at post forms for more end-of-life discussions, but at least plants the seed for discussion for later times with family. We take a look at that and then come up with a personal preventive plan that's really geared for the patient. The Medicare Wellness Visit is unique in that because there isn't exactly a physical examination that's required, we often do annual wellness visits as telemed video visits. We are still able to have the patient fill out their questionnaires and then we still go through them. We really have a great opportunity to connect to people who have motility issues, transportation issues, or maybe they're having to take care of a family member at home. What is not included within the realm of the Medicare Wellness Visit is if somebody has a new issue that they wanted to bring up that has never been addressed before. For instance, if somebody again said, I injured my shoulder yesterday and I'd like you to evaluate that. If we have time, we do try to incorporate that into the visit time. Sometimes we don't have enough time and they will often be documented separately and possibly billed separately for their insurance. We like to try to do it all at once, but it is not necessarily part of the Medicare Wellness Visit. We do recommend once a year because again, circumstances can change, and studies do show that those who have Medicare wellness visits are more engaged in their care overall, probably have a closer rapport with their clinician, and studies do show that there are lower rates of hospitalizations and ER visits. So it's overall a win. For Medicare Advantage patients, they actually do have both a covered annual Medicare wellness visit, and then they separately also have a complete physical exam that's covered. If you haven't had your annual Medicare wellness visit yet in the last year, really do encourage you to get that scheduled. After a Medicare wellness visit, a patient should feel heard. They should feel like their clinician knows more about them, maybe understands them better, and I think going forward will be a better clinician to them. They go home with a personalized preventive care plan that lists the things that they may want to think about working on for this next year. We want to keep you healthy.